Quick disclaimer. This podcast is not meant to be professional advice of any kind. It is meant to be informative and entertaining. If you plan to make any changes to your health routines, please see the appropriate professionals before doing so. Welcome to episode 239 of the Ages Podcast. I'm David Stewart. Today we're joined by Dr. Andrea Spina, a luminary in the field of human movement and joint health. He was the creator of the functional range conditioning, otherwise known as FRC. If you've ever been with a PT or a good trainer, they've probably used this. Dr. Spina has revolutionized how we approach mobility, strength, and longevity. His methodologies are embraced by elite athletes and health professionals worldwide, including teams the NBA, the NFL, the UFC. Here's a sneak peek into our conversation.
Injury is a very easy mathematical equation. If the forces going into the tissue exceed the ability of the tissue to absorb that force, you get injured. There's an active component of mobility which is absent from flexibility. So if you call flexibility the ability to passively achieve a range of motion, mobility is your ability to actively achieve that range of motion utilizing your own force as a device.
We're going to get right back with Dr. Andrea Spina's movement solutions after this quick message from our sponsors. Today's show is brought to you by Element, spelled LMNT. Go to drinkelement.com and get yourself a free 8-serving sample pack with the purchase of any of their electrolyte drink mixes. I had major knee surgery. I'm focused on healing myself. MitoPure from Timeline is helping me do just that, supporting my mitochondria for better energy and strength. Now in a zero sugar strawberry gummy. Yum. Get 20% off. That's 20% off at timelinenutrition.com with code AGEIST, AGEIST. If you know me, you know I don't do filler snacks. I need something that works as hard as me. David Protein Bars deliver 28 grams of protein, 150 calories, and zero sugar. There's no crash, just clean fuel that actually tastes good. Made with egg white, collagen, whey, and milk protein, my favorite flavors are cinnamon roll, chocolate chip cookie dough, and salted peanut butter. Buy 4 boxes, get the 5th free at the link in our show notes today. In our conversation, we're going to explore the science behind FRC, the importance of joint health as we age, and practical strategies to enhance our physical resilience. Whether you're an athlete or someone seeking to move better and feel stronger as you age, this episode offers valuable insights into optimizing your body's potential. So let's jump into today's discussion with Dr. Andrea Spina. Dr. Andrea Spina, so great to have you. Is it okay if I call you Dre?
You can absolutely call me Dre, sir.
Wonderful. Dre is the name of one of my good friends, so it's easy for me. Tell me, where does this podcast find you today, Dre?
Location-wise, I'm in Canada. I'm in Milton, Ontario, Canada, just outside Toronto.
Your area of expertise is something that's very near and dear to my heart, which is mobility.
Yes.
And before we get into this too much, tell me a little bit about your background and how it landed you where you are today.
Sure. My background from an educational standpoint, I studied kinesiology in my undergraduate degree, and then I went to chiropractic school at Canadian Memorial Chiropractic College, which is located in Toronto, Ontario. And as soon as I finished that, I did a 2-year postdoctorate specialty in sports chiropractic. And during that time, I would say from about the 4th year, the chiropractic program is 4 years before your specialty. At the end of the 4th year, I started developing these systems that I decided to start teaching first to, a small group of manual therapists, but then that kind of exploded into my career for the last 20 some odd years. So the system that I teach, like you had said, it's part of it is mobility. That's a large percentage of it, but it all started in manual therapy because although I'm a trainer, I started off as I noted as a manual therapist. So it all started with anatomy palpation, soft tissue manipulation and treatment, and then that kind of escalated into joint health and mobility training, which escalated into joint assessment, which escalated into strength and conditioning, et cetera, et cetera. So it's kind of like a overarching system that I started back in 4th year of my study. If you ask me why, I will likely say I don't exactly remember why I started off kind of in this continuing education teaching realm, but it had something to do with being in school and not being particularly happy with the answers that I was being fed. Or I could also say not being happy with the way that I saw scientific literature being interpreted in my field. And then that led into this kind of how many years long search for what I would have considered the truth about how to manage a Homo sapien in time. So I pretty much did really deep research dives for many, many years. And then the system that I teach kind of popped out at me. And now I don't remember how to do anything otherwise because it just made so much sense at the time. So since that time, that fourth year, I've been teaching and certifying people all throughout the world, and that brought me here, I guess.
Before we get into the system, let's get to some baseline definitions here. When you say mobility,
Yes.
what does mobility mean to you?
That's a very good question, and I would say that for the functional range conditioning portion of the system, that question is the catalyst that kind of started the journey. So let's go back in and around 15, 20 years ago. I'm hoping the definition has changed now, but back then the concept of mobility was kind of inexorable from flexibility. It was kind of like making yourself loosey goosey is kind of how the average person kind of understood it. But from a technical standpoint, there's a difference between flexibility and mobility. So flexibility is the ability to passively achieve a range of motion under an external load. That external load could be gravity, or it could be a therapist pushing on you, or it could be you kind of leaning or pushing yourself to stretch. So achieving a position passively is what we would term flexibility. Now, the difference with mobility is if you really look at the definition, mobility comes from the Latin term movere, which means to move. So there's an active component of mobility which is absent from flexibility. So if you call flexibility the ability to passively achieve a range of motion, mobility is your ability to actively achieve that range of motion utilizing your own force as a device. So, like I said before, mobility was kind of thrown in with flexibility, or it was considered to be a warm up to prepare your body for strength training. Whereas the way that I see it and the way that I teach it is that mobility is simply strength training in order to achieve and cultivate new ranges of motion. So really, it's the same thing as strength training if you just think about it as being applied to an area that you can't move into, then you're utilizing the mechanism of strength training in order to improve your ability to achieve range of motions actively. And that's the most fundamental way to define mobility in my eyes.
So let's bring up an example here.
Okay.
So within FRC,
Sure.
which would be functional range conditioning,
Sure.
most of us, myself included,
Mm,
our hips are tight,
sure.
which makes it harder to get off the floor without using your hands. Getting down in a deep squat can be difficult or painful. I mean, there's seems like modern life really conspires against our hips.
Yes.
So give me an example of how you would approach that.
Well, this is the I wouldn't call it a problem, but one of the issues with the way I teach is that I teach to the healthcare professional or the trainer. And then the system is dedicated towards them, and then they take it and then they use it on that end user. So
Mhm.
when someone asks me about hip mobility, there's much more to discuss in my realm. Like if I'm taking someone like you and you come to me as a patient and you say the same thing that you said, I have, limited hip mobility. The one of the problems lies in the way that we define your problem in saying I have
Mm.
limited hip mobility. Because to me, that doesn't mean anything. Clearly, you have mobility in some regard because you're able to walk around and sit and maintain your activities of daily living. But then there's a specific question saying, where can you not access ranges of motion? So what is it about your hip that you're lacking? Now I can go through and I could list the most common to least common because there is a pattern to this. When hips become dysfunctional, or if we add aging into the mix, there are certain things that tend to go first in terms of range of motion. Not that it's important for this conversation, but internal rotation of the hip is probably the manual MRI that I can use to determine the health of that hip. But it's more a matter of me looking at the hip and checking it in all direct ranges of motion and then deciding what range of motion is the most limiting factor for this hip, and then sequentially we assign exercises in order to expand and then cultivate those ranges of motion. So what do I mean by cultivate? Traditionally, people that are stiff, they might go somewhere like yoga, for example, which of course I'm not saying is a bad idea. I think yoga is great. It has its severe limitations, which I'm going to get into. But putting someone into a position and getting them to passively sit there for a long period of time, while in time it might increase your passive flexibility, that's not really useful in terms of real life. In real life, we're not taking pictures for Instagram. So it's not a matter of achieving ranges of motion to show off. It's a matter of how can you get to that range of motion. So the system will look at the hip and then it'll determine which range. Is it flexion? Is it extension? Is it abduction? Is it adduction? Is it internal, external rotation? And then try to quantify those ranges both passively and actively. And at the end of that, I really understand everything there is to know about your hip. I can tell you, exactly what would improve your ability to squat or your ability to sit or your ability to walk. And I think one of the things that sets this system apart is that specificity where mobility isn't this generic ethereal concept of, my hip is stiff, how do I make it unstiff? Mobility has to ask the question, why is your hip stiff? Exactly what tissue is making your hip stiff? Hip stiff, your hip stiff. Yeah, that's right. That sounded weird as I said it out loud. And then it's a matter of attacking those tissues one by one in order to allow the hip to improve range of motion actively. So I don't know if that answered your question, but it's a really important thing to point out. And I'll give you one reason. If you look, the Instagram kind of YouTube type stuff, you'll see people that'll say, what are the 5 best exercises for hip mobility? And as soon as I see that that's the title of an article, I put that into my top 10 worst articles ever list. And the reason is because there's no such thing as what's a good mobility exercise. It's like saying, what's the best shoulder exercise? Well, if I look at your shoulder and I see that you can only actively lift your shoulder up to here before you start cheating and extending at your low back, well, then an overhead pressing exercise might be a great exercise for some, but it's a horrible exercise for you. So there's a specificity here that people need to account for, and that's why a lot of the system is dedicated towards teaching the client how to assess themselves and then how to make determinations as to what it is they need to be working on. A good example I said before, somebody might say, my hamstrings are not flexible and therefore I can't flex my hip properly. And 99.9% of manual therapists and trainers will say, well, what do? We say, what are the 5 best hamstring stretches? And then we'll apply those stretches. But the body is three-dimensional. So it's not a matter of looking at a muscle from an external perspective and pointing at it and saying, well, because you want to go this way and this muscle gets longer when you go this way, that's the reason why you have the problem. It's a little more complicated than that. If, for example, the hip joint capsule, the part deep inside your hip, which is really, you know, containing the joint itself, which is just 2 bones that come together. The joint is really the space between 2 bones that allow the bones to move independently. So around that you have a capsule, and around that you have a layer of muscle, and around that you have another layer of muscle. So you really have to have an understanding as to what depth we want to work at. If you give me a hip where 2 bones come together, and then I tell you to flex your leg forward to stretch your hamstring. Well, if the entire hip moves as one unit, well, then you're not really doing anything for the hip. So if it's the fact that the capsule around the hip joint is restricted, it doesn't matter how often you stretch that hamstring. The fact is that the bones that make your hip are unable to move independently from one another. Ergo, the target of your exercise has to be right deep inside the capsule to first promote
Uh,
motion between the 2 bones. And then we can look at the superficial tissues, which are there to guide the motion between 2 bones, but not necessarily to determine the motion between 2 bones. So again, there's a layer of depth of understanding, which really, when it's explained to a layperson in the way that we explain it, it's not difficult to follow as a system. But conceptually, I have to spend a lot of time explaining to people that it's not a matter of getting up and kind of wiggling yourself around and saying, "Oh, I'm working on my mobility." The problem with that, of course, is that wherever you wiggle around, you're only going to move where you can move. And something I often say is you can't move where you can't move, which means you can't train where you can't move, which means you can't communicate with the tissues that are supposed to move you into areas that you can't move. So we have to dive a little deeper and answer that question. Where is it you can't move and why? And then via tissue specific inputs, we can start to reverse engineer that hip for you.
I can say, having been on the other side of this a few times, I would much rather be doing squats or hamstring stretches
Yes,
than FRC stuff because
absolutely.
it's really hard.
Yeah,
It's
it's funny. It's people on Instagram land or whatever. They consider mobility work to be this easy thing you do before you train, and then they train with me and they start begging for deadlifts again because and that's the whole thing about it is I like I said at the beginning, or I don't know if I think we mentioned in the preliminary discussion, I don't do anything different in terms of literature. So people will often say, "Oh, he's doing something amazingly different. Like if you learned under me, you would be learning these concepts that are nowhere found in research," which is the exact opposite of the truth. All I do is I take the research that's there and I drive it at more specific targets. So you said that it's very difficult. You're right. If I give you an exercise for your hip capsule and I want you to really learn how to break open that hip capsule, it's not going to be, there's not gonna be soft music playing in the background, it's not gonna be oiled up massage, it's getting on the floor and it's applying the same intensity you do to, let's say, a max effort bench press, but driving the signal into where you need the signal. Almost 99% of all problems that I see when people come to me with their training programs is that the training programs are far too generic, they're far too predetermined, they're not specific for David's hip or David's shoulder. People just kind of use a bunch of named mouth noise exercises. I do the squat or the deadlift or the bench press instead of thinking about how is that predetermined movement path going to affect David's hip and David's shoulder. So there's a step of specificity in mobility training, but that extends to all training that people just aren't taking. And therefore, things like prerequisites are just not determined. Like if you tell me you don't have a hip that can internally rotate, and then I see you in the gym squatting, we have a problem because if you're, as I said before, if a hip can be defined as the femur and the pelvis coming together and moving independently from one another, but if I take your hip and try to internally rotate it and the whole thing moves as one unit, well, now you don't have a hip, if that makes sense. You might be able to achieve a squat, but you're not achieving the squat in your hip. You are going to compensate for your lack of hip by putting more stress on your knee or more stress on your low back. In which case, doing a squat is not for David. I often say that if you give me a named exercise like a squat, I will tell you that squatting is not for your hip, but you have to use your hip to squat. And people have that confused. And that's why exercise programs become generic or what are the 5 best exercises for my hip? And it's not that easy. And when you apply exercise prescription to people who don't have the prerequisites of motion for those exercise, then you're not really prescribing a hip exercise. You're prescribing a compensation exercise, which leads to problems because, as you know, you said your knee is not your hip. Your knee is not supposed to be your hip. So if you don't have a hip, the onus of the movement gets pushed up into your spine and down into your knee and then down into your ankle and then down into your foot. And these things start taking over the job of the hip that's not there. And then you end up, the injuries can happen almost anywhere in this chain. And then it becomes very confusing. So, again, you sprain your hamstring for whatever reason, and you think it's because of your hamstring, and you rehabilitate your hamstring, and your therapist rubs your hamstring, and you put ice on your hamstring, and that all gets better. But the problem is that it might not have been the hamstring's fault that the hamstring is injured. That might just be the result of the injury. So again, it's really a matter of taking a human and then quantifying what is it that they're capable of doing, altering their current exercise so that it's within the realm of their capabilities, and then assigning additional exercises in order to put the inputs where we need them to get the changes where we want them.
Don't go anywhere. We'll be back with Dr. Spina after a brief word from our sponsors. Did you know that just pounding water all day is not going to keep you hydrated? You need the right mix of electrolytes in that water to help that water be absorbed properly and also to help your body function well with the right electrolytes. Element, LMNT, contains sodium, potassium, and magnesium, which are critical for helping our brains and our bodies function. One of the unfortunate facts is as we get older, it's harder to drink water, essentially because our thirst response is diminished. So we need to put extra emphasis on drinking water, staying hydrated with the right electrolytes. Of course, if you are pre-hypertensive or have hypertension, check with your doctor before having anything with sodium in it. For the rest of us, though, Element is a great solution. Go to drinkelement.com, that's DRINKLMNT.com, and get yourself a free 8-serving sample pack with the purchase of any electrolyte drink mix. Today's show is also brought to you by Timeline. I want to talk to you about something that could change the way you think about aging and cellular health. We've all heard the phrase mitochondria are the powerhouses of the cell. But what does that really mean to us as we get older? Well, it turns out quite a lot. Mitochondria don't just produce energy, they are central to muscle strength, vitality, and how we age overall. By the time we hit our 30s, these little powerhouses start to decline. No good. Less energy, slower recovery, aging that you can feel. Yeah, we know what that's like. And I'll tell you, coming off of major knee surgery, I've never been more aware of just how important recovery and strength really are. That's why I've been taking MitoPure. It's a scientifically backed formula that supports mitochondrial health, helping increase muscle strength and energy in as little as 2 months. No extra workouts needed, just real cellular level support. And now, get this, it comes in a zero sugar strawberry gummy. Yum. Same science, same power, now easier to take every day. If you're thinking about trying Timeline, this is your sign. We're offering our listeners 20% off. That's 20% off your first purchase. Just use code AGEIST at checkout at timelinenutrition.com. That's AGEIST, 20% off. More strength, more energy from the inside out. What I'm hearing you say is something that I've heard a lot from other guests and more in like medicine nutrition, which is you're talking about personalized movement. And it's something that I think is really lacking. That, as you said, you get an app, you get an exercise program, you got a trainer, and his job is just like put more weight on regardless.
Yes.
Or even, you mentioned yoga. I have been injured worse in yoga than in martial arts or ski racing or any of the other stuff I do.
Yes. It's a funny thing, and again, not to insult yoga in any way because it's a great practice. It's just that there's prerequisites for yoga, and people don't treat yoga as a sport. But anytime you confine the variables of motion, the movements you end up with are not normal motions inherent to the body, right? So if I say I want you to go into a downward dog, why would you go into a downward dog? Well, because a downward dog is good for this tissue, this tissue, this tissue. Well, that's true if you can extend at your hip, if your spine can segmentally extend, if your shoulders are able to compress and retract. All of those things are perfectly fine to achieve the pose of a downward dog. But once again, the downward dog is not for David, right? It's for the achievement of this predetermined mouth noise that we call downward dog. So now you're in this position of downward dog. And if you think about the premise of yoga, or at least how people understand it, your job is to get into downward dog and then stretch into downward dog. So if you can imagine, you give me a lumbar spine, a low back that is unable to extend segmentally. It gets a little complicated, but your spine, of course, is made up of a variety of bones sitting on top of each other. Now, when I extend myself back, you see me do one motion, but what actually happens is all of the individual joints extend a little bit, little by little, little by little, little by little. But if you give me a chunk of a low back that can't extend, okay? Well, now the problem is that the person needs to extend because they're told to extend because you got to get into a downward dog. So the onus of motion automatically gets pushed up the spine or down. If you give me a chunk of the spine that can't move, doesn't matter how much you want it to move, it doesn't move. Ergo, doing the stretch, you might think you're getting a nice stretch throughout the entire spine, but you might be forcing the onus of the movement to the joint above the chunk that can't move, forcing it to move too much. So now the question becomes, was downward dog a generically good exercise, or is downward dog a body position that has prerequisites needed in order to achieve? Because if that's what it is, which is what it is, and you don't have those prerequisites, now we have a problem because the signal that you think you're sending in the body, just because outside you're doing it, everyone looks at it and goes, "Oh, he's doing downward dog." That doesn't mean that inside the body is accepting the stimuli in the same way. If I do a downward dog and you do a downward dog, it's a completely different exercise. It might not even target the same stuff. I have people, I'm in a downward dog. Oh, it feels really good. Where do you feel it? I feel a pinching in my low back as I stretch. Well, that's not what you're supposed to be feeling. If you go into an extension position, you're supposed to be feeling a stretch on the anterior tissues, whereas the posterior tissues compress. But if you're telling me that you're compressing the posterior tissues and you're feeling restriction in the back, that's not where you're supposed to feel it. And that's what happens. You give 10 people a a stretch for their groin muscles, and you ask 10 people while they're doing it, "Where do you feel it?" And you get 10 different answers. And maybe 5 people say, "I feel it in my groin muscles where I should." Then you have another 5 saying, "I feel a pinching in my side," or "I feel a compression in the back of my hip." But when you're running a class and you have these predetermined exercises, that doesn't matter to the instructor. What matters is that everyone is forming the particular shapes that coincide with the mouth noise that we gave to describe this particular exercise. And that is the problem. And it kind of sucks because it sounds like I'm telling people that everything they're doing might not be a good idea. But if you look at the body in this way, it's very easy to take anyone and eliminate exercises that are not working for them and pull in exercises that enhance those inabilities. So another thing that people often, when I start talking, they think to themselves, I say, if you lift your arm over your head, how high can you get it before your back starts extending? And then people start going, oh my God, I can't do any, like, as soon as I move. And then they go, well, this guy's going to tell me to stop training. No, that's not the case. As you know, probably from the bio, I train Olympic athletes and professional athletes and people of all different shapes and sizes. And it's not like you have to stop, but you do have to consider that you can't move where you can't move. Moving into areas you can't move, especially under load, probably not a good idea. Like when I have clients and I ask them, if you can only lift your arm over your head this high, do you think it a good idea to press weight over your head in this position? And then, oh well, no, that's probably not a good idea. And that's the point. The point is that the standard model of exercise has it that your job is to select from a predetermined list of named exercises and patterns, and then you're just supposed to kind of take the ones that you find the best and put them into training for David. But that's a recipe for disaster, and that's one of the reasons, in my opinion, why we have, all of this new technology, but elevating amounts of osteoarthritis. All of this great new training, but elevated amounts of sports-related injuries. Again, it's a lack of specificity that is really the problem. And mobility, I would say, is probably at the heart of it because it's an I know I'm ranting here, but movement as medicine is something that's often said. Like when someone gets up in the morning, everyone encourages you move around, be dynamic. Have a morning routine of this, and it's all great. I'm not going to say that movement is not medicine. Okay, that's the term. Movement is medicine. But like I said before, if I can't move my shoulder, and I'm talking about the two bones making up my shoulder on the inside, if in order to move my shoulder, I have to do something like this, which is move everything to compensate for my shoulder, then the actual bones between the shoulder, what's called the glenoid fossa and the humeral head, they don't move relative to one another. Does that make sense? If I lift my arm like this, and it's really a matter of the two bones of my shoulder moving together as other stuff stretches in order to allow it to happen. Now, this is a fundamental problem, and here's the answer to all of your questions. The only way to maintain health in a human articulation or joint is ongoing movement of that human articulation or joint. In other words, there's no if your shoulder doesn't move, there's no amount of exercise outside of the shoulder which will drive health into that shoulder that doesn't move. If you read literature, the one thing that we know is if you stop using tissue, that tissue begins to go away almost immediately. It's like you stop brushing your teeth will rot away. If you give me a shoulder that doesn't move, someone who doesn't dynamically try to make it move over a long period of time, because there's no movement coming from the shoulder, your nervous system literally forgets you have a shoulder. It's like, I haven't heard from that joint in forever. And the problem is of course, the shoulder joint, there's cells that have waste product in it. You have to move to imbibe new fluids or to push out old stagnant fluids. And again, it doesn't matter how much I move like this. The old stagnant fluid is in that shoulder joint will not leave unless movement occurs. Another problem is the cartilage of joints, which we know to degenerate over time. They have a very poor blood supply as it is. So in order to improve the blood supply, you literally have to move the shoulder so that you imbibe new
Mm.
fluids. It doesn't just happen on its own, and that's the problem. So you can, again, do a mobility routine, quote unquote, for forever. But if you're not using your shoulder, then technically it's not a mobility routine for your shoulder. So technically, movement as medicine is not specific enough because movement is medicine for the specific joints that are undergoing the movement. That was a lot.
Okay.
That was a lot.
Yeah, it was.
Yeah.
So what I'm hearing, Dre,
Yes.
is this idea of fitness becomes more complex. So we have cardiovascular, we have VO2 max, we have sort of steady state stuff, we have strength training. We know that we need to maintain muscle mass.
That's right.
These are all great.
Absolutely.
However,
Yep.
we have this other element here,
Mhm.
which I think is a bit more sophisticated than most people are used to, or maybe not. Maybe it's just me. And it's also, I just want to say, having been exposed to some of this, it's really hard.
Yes,
It's
yes, it's super
such. It's not hard in the way. I'll explain this as a patient
yes.
or as a client of someone who's done this to me.
Yeah.
It's not hard like hit training. That's just sort of like short term miserable
Yes.
or like some max lift. Okay, I got to be like really focused on this thing for like short period of time. This is more brain stuff
Mm.
and like getting if I'm in like some sort of like a hip car position to
Mm.
like move that lower leg up in a way that it my brain thinks can't happen.
Mm.
Becomes an enormous amount of concentration on my part
Yes.
to just move it. It should be able to move quite a distance. I could just move this tiny, if anything, I'd move this tiny little bit. And I'm just thinking, what amount of force can I manage to move this? And the answer is none.
Yeah. You know what? You bring up a good point that I think is worth unpacking. Is that let's go back to the passive stretching kind of idea. You passively what's the best way to explain this? Okay. If you passively stretch, I will tell you that in time you may increase your range of motion. Okay. But the amount of force experience in the tissue that you've increased that range is 0. So if you can't achieve a range of motion, that means you haven't been there in a prolonged period of time. That means any muscle fibers that are supposed to be, you know, absorbing forces in that range, producing forces to move, you haven't done that because the range has been blocked off to you. So the nervous system, like I said before, the brain doesn't really know what's happening in the outside world. The brain is literally in a vault, a dark, wet vault, which, underneath a half inch of bone. It literally has to grow eyeballs out of it so that it can actually see the outside world. So the brain is only getting information by what it takes in or what it feels, if that makes sense. And what I mean by feel is all of the receptors in your body send information to your brain, telling it how it's going, how's the muscle, how's the capsules. So if you don't move a particular area or into a particular area, your brain's understanding of that area goes away. It's just not there anymore. It's almost like you're walking through, remember those old school video games where you're walking through a three-dimensional environment and everything looks fuzzy, but as you get there, it starts to open up. Yeah. Imagine that you just can't go to the right. Like that area isn't available to your brain. So your brain, because it's so efficient, it forgets it's there. Okay. So now you stretch and you passively get yourself into this range of motion. Well, unfortunately, passively getting you there is not going to inform the brain any better as to how to absorb force or produce force in those ranges. So there's a huge step that you're referring to. You start working and you're trying to lift your leg and you're like, oh my God, I feel like I can't.
Yeah.
That's the point, is that when you open up new ranges of motion, if you're doing it in a scientific way, you have to then reintroduce that new range of motion to the central nervous system. And then once you reintroduce it, you have to then get it to start absorbing load. Now, if you have no experience loading that tissue, of course you're going to start at body weight load, which is why you're doing your hip circle or your hip car, and you're like, oh my God, this is hard because you haven't been there before. So now I have to fill in that gap. And filling in that gap is very important. Number one, just because you can passively do a split, it doesn't mean you can actively control 180 degrees of your hip, right? And that's a problem because the only way to prevent injury is to be able to absorb forces coming in. So imagine you open up this new range of motion, you don't strengthen the range of motion, you don't increase the amount of force absorption of that range of motion. Well, now you have a range of motion which is dangerous. You have a range of motion in you cannot apply force. So when forces come in, injury is a very easy mathematical equation. If the forces going into the tissue exceed the ability of the tissue to absorb that force, you get injured. That's the equation. So if you give me a person who can do the splits, but when I stand them up and say, lift your leg up, they can only lift it up to 90 degrees. That's another 90 degrees, which you can get there forced, but you have no control, no neurological understanding, no ability to execute strength. Ergo, whenever you're challenged in that range of motion, you should expect an injury to occur. It needs to be understood better. It's like if someone's going to squat and I see that they can't get into a full depth squat until they do 20 minutes of foam rolling on their hamstrings. Well, that's like saying, I'm going to beat my hamstrings up for 20 minutes. I'm going to make it so the nervous system just deadens that feeling so that it will go into that range of motion. But now you're going to do it under a max effort load. So now the problem is while you're squatting, you're going into a range that you've only artificially opened up. So that means if something goes wrong in that squat, you have no way to compensate for those force changes and and you end up getting injured. And now, of course, your trainer says, well, did you drink enough water before you trained? Or, did you have electrolytes? But no, it's the trainer's fault. The trainer should have known that you're giving an exercise for which you have no control over the movement. The fault is the trainer's for assigning an exercise outside of the scope, let's say, of that human's capabilities.
So let's say, so my knee is recovering from surgery,
Yes.
and I know that the maybe 2 years leading up to this, my movement patterns were compensatory. There's some stuff I know with all through my body because my knee hurt, so I was not moving the best that I could. So that's sort of I'm going to want to improve this stuff as I'm able to move my knee more, getting in and finding somebody to help me. How would I go about sourcing someone like this? Because as you said, the majority of people out there, they're going to sort of fall into these other foam rolling. I don't have anything against foam rolling. I feels better when I do it.
Or do I if for that reason, like, you know what I
Uh,
mean? There's specifics here to these there's nuances as there is to everything. Politics, for example. There's nuances to all of these topics that people just, they just look past, right?
yeah, I mean, it feels good to me. I like to stretch my pecs. I feel better when I do that.
Yep.
But we're talking about something different here.
Mhm.
And how would I go about sourcing someone? Because I think that's in so much of this world that we're in now, where we have this idea of personalization. You have agency over the outcome of so much, but that also entails the responsibility of sourcing the right people to work with, and that goes with the healthcare providers, like up and down the line, right?
Yeah.
So that is oftentimes the friction point
Mhm.
of how do I find the right person to work with? Like I'm willing to do it,
Mhm.
but who are they? How do I do that?
Yeah, okay, okay, so before I say this, I will point out whenever 9 out of 10 people think the other guy's wrong, right? So I understand that anybody listening, it would always sound with every guest likely that they have the answer and everything else doesn't work. And I want to make sure that everyone understands that that's not what I'm saying. And I'm not saying don't go to yoga. And I'm not saying don't move around and exercise. These things are wonderful on a whole. If I was the ruler of the world and my job was to take the masses and make them slightly more physically healthy, I can give very generic advice. Okay. The problem is that if you really want your body to function maximally, then the generic advice isn't good enough for David. So David needs more specificity. Now I can say we have a find a provider area of our website at functionalanatomyseminars.com, where we have tens of thousands of practitioners throughout the world. Wherever you are, you can probably find someone. But I think more importantly is people understand the basic premise of what I'm saying, because there are certain things that you can do starting now, right? That would help.
Right.
For example, in order to really unlock your body and to keep it healthy, it starts when you wake up in the morning and it ends when you go to bed at night. And if you think about how our genome was forged 200,000 years ago, we're not much different now than we were then from a physical standpoint. So you have to look back at to what types of things were we exposed to 200,000 years ago. And 200,000 years ago, it puts us back into hunter-gatherer days. And I'm not saying that we should all, go out and start swinging from trees and hunting our own food barefoot, but the understanding that those humans were exposed to a large variety of movements throughout the course of the day, throughout the course of the month, throughout the course of their years, and understanding that confining those motions as we do, there is a detrimental effect. The fact that we're going to sit here for an hour and talk is not a normal thing for what the body thinks it needs and if that makes sense. At that point, there was a variety of different motions, and that's how the system evolved. And it evolved in a way that when you move your joints, you reap the benefits of moving those joints. So the human system from a natural selective process is incredibly efficient because just moving is the thing that makes the tissues that you're using to move with more robust. So if we consider it that way, it's a matter of plugging more movement throughout your day. So we have this one technique that we use that a lot of people might have heard of called controlled articular rotations, or CARS. This is not a secret. You can go on YouTube. There's thousands of people who have CARS routines for mobility all over the internet. You can come to our website, of course, where it came from. But just the idea of learning a routine of CARS, which is simply learning how to move all of your joints throughout a full range of motion and then doing so on a regular basis. Just learning that I would say, would improve the health of the joints that you have and would maintain the ranges that you have right now, right through to the end if you did them kind of religiously. The other good thing about learning these maneuvers, CARs, is that just in learning these particular paths that you go through, if you understand what you're supposed to feel, you understand when you're not feeling what you're supposed to feel. Like, for example, if I bring my arm up this way, I should be feeling a pull down here. I should not be feeling a pinch up here. So we teach it with these little rules that kind of highlight in your brain, oh, I can't go that way. So if you take that information, and this is a matter of you do it over a few weeks, you learn about yourself. You ever see Weekend at Bernie's? Remember that movie where the person was dead and they just kind of walked them around and they were kind of making believe he was alive. So they're just kind of see people they seem to be very uncomfortable in their meat wagon, and that's because they're not used to moving in the meat. They're just not used to it. So when I isolate movements, I say, do this routine, and the person sits there and they think about their shoulder and they think about what the shoulder feels like. It goes back to what you're saying before. You increase the connection between the neurology and the shoulder. So now your brain starts understanding what a shoulder is. When you start feeling restrictions, you start saying, oh, I can't go this way, well, maybe I should relook at my exercises and start to minus some exercises that I need to go that way that I can't go in. And you start to break those down. So now you're doing these cars, you're doing them on a regular basis, you're taking inventory of yourself. The fact that you're putting specific movements on a regular basis, like I said before, you're imbibing new fluids, you're getting rid of waste products, you're bringing health to those articulations. If you just started there, you'd be much better off because you would understand how to mold your exercise to at least not hurt you, right? Now, these cars are not going to improve your mobility, but they are incredible indicators to someone who might see that problem. And then you can start getting into the specific exercises that you seem to hate, which are, tissue specific. So I'd like at one point that, people learn about the body in this way. Like people learn about exercises. They say what you're doing is too complicated, but people learn about you know, stiff-legged deadlifts and hack squats and snatches, like, those are much more complicated than finding an area you can't move into and then applying specific exercises to move into those areas. So there's this learning curve, which unfortunately, it doesn't take a lot of time, but we're so used to this, you wake up in the morning, you go on Instagram and you look at someone doing a cool exercise, and then "Oh, I wanna do that exercise," as if the exercise itself has some magic power.
Mm,
But if we just stop to think to ourselves, exercises are just stimuli that speak to body tissues. And if you think about it that way, you start to become more specific in what signals you're sending to those body tissues. You start to think to yourself, are is Olympic lifting, this is it gets back to longevity and health. People think this idea like performance training is going to bring you longevity and health. Meanwhile, when I implement performance training on professional athletes, I have to then implement exercises to counter the detrimental effects of those performance exercises. So people are, "Oh, I want to be more healthy. I'm going to start doing Olympic lifting." And you're, I don't know, 45 years old. It's like, well, whoa, whoa. Number one, are you an Olympic lifter? No, I'm not. Do you understand the dangers of Olympic lifting? No, I do not. Do you understand that Olympic lifters probably did Olympic lifting for years without any weights, just practicing technique before they did that? No, I did not. Do you understand that with your shoulder not being able to flex up, every time you do an Olympic lift and you land it safely, the low back or the place that you're compensating is what's going to take the brunt of that force? No, I didn't.
mm.
And now we start to go, well, holy moly, is Olympic lifting just because it's performance based and just because it's exercise? Is that good for me? And the answer is no. The cost of high performance is your physical health. I always point to people, if you've ever seen an athlete, an NFL athlete in their retirement, it doesn't look comfortable. We're dealing with people who have had multiple knee surgeries, multiple hip surgeries, multiple injuries, loads of scar tissue. This all gets back to this misunderstanding as to what we're supposed to be doing with exercising. Exercise is not generic. It's supposed to be human centered, and humans are not the same. And we understand that any other time. We understand that if you have children, oh, my daughter doesn't learn this way. She needs to learn a different way. We understand in other I can't eat lactose or I'm sensitive to gluten. We understand this concept, but for some reason, when we go to the physical body, all of that gets thrown out the window and we're just
Mhm.
doing, I'm in a CrossFit class, 100 people in a class, and we're doing snatches for time. And I often say, if you give me 100 people and you say, Doc, how many of these people have the prerequisites to do a snatch? Random people off the street. The answer is probably zero. It probably no one at this point is just ready to do that exercise. But again, it's just what we do. And when it doesn't work, what do we tell? Do more of it. And you see, it's just this self-perpetuating problem where we have the research, we know what we're supposed to be doing, but the lens that we're filtering this information through is wrong. I'm going to yoga. You're not yoga. Like, yoga doesn't care about David. David's body must perform yoga. So, in order to do yoga, don't look at yoga for benefit. Look at David's body and whether or not yoga can provide benefit for David. It's a different way of thinking about it. And to your point, to answer the question without being so vague, yes, we have practitioners all over the world. We have assessment protocols, we call them functional range assessments, which maps out your three-dimensional capabilities, both internally and externally. So I always say, once I run an FRA on someone, a functional range assessment, I can tell you, where your big toe can and cannot move, where your kneecap can and cannot move. I have a full description I call it the physical. I don't know if you go to the medical doctor and you go for your physical, but your physical ends up being a chemical because what do? They take blood samples, right? And your blood's fine. But who is monitoring the physical abilities of David moving forward in time? But if I can take a snapshot with a functional range assessment and I can look at your three-dimensional capabilities and I do it today, and then I do it 6 months from now, and then I do it 6 months from then, I can start to see trends. I can see now your shoulder was moving this much. Possibly you've been concentrating on that squat a little bit because now your shoulder mobility has gone down. So now I can rejig your exercise to bring that shoulder mobility up as I try to maintain all the benefits from the first chunk of programming. And you just keep doing this in time. It's like this give and take dance between practitioner and client where I'm monitoring you, I'm giving answers to your questions based on you. I'm making decisions based on you because I've laid out what you are as a physical being. So, long answer to your question, there are ways to get specific with you can find one of these practitioners, but you can also pull from what I'm saying these very small Easter eggs that would help you immediately without the help of anybody else.
We're going to get right back with Dr. Andrea Spina's Movement Solutions right after this. You know, I've always believed that what we eat, especially when we're on the go, can either push us forward or hold us back. And as someone who's constantly moving between travel, work, and workouts, I need snacks that actually do something, and not just filler. That's why I'm a huge fan of David Protein Bars. These aren't your average protein bars pretending to be healthy. Each one packs 28 grams of protein, 150 calories, and 0 grams of sugar. That's right, zero. Built on the real science of satiety and energy, milk protein, egg white, collagen, wait, all blended to deliver a complete amino acid profile. It's like a little powerhouse in your pocket. No crash, no sugar spike, no regret. And the best part, they taste great. My favorites being the cinnamon roll, chocolate chip cookie dough, and salted peanut butter. These are bars made for people like us who care about how we feel after we eat, not just during. To be honest, I was eating these daily before David Protein ever reached out to partner. That's how much I believe in them. If you want to snack smarter, fuel better, and take one small step toward the life you're aiming for, this is a great place to start. Get to the link in our show notes. When you buy 4 boxes, you get the fifth free. That's a good deal for something that actually makes you feel good.
It all comes down to personal responsibility.
It really does. Yeah.
Good life is work.
Yes, it is. Yes, it is. You know, it's funny because one of my the way that I approach teaching and one of my main interests is evolutionary biology, and it's interesting you say that because it's almost like whatever happened throughout the course of our history, we were given this impression that you deserve to be healthy.
Right.
Like you go to your doctor and you say, let's say a 50-year-old person who's, a 50-year-old, I don't know, construction worker. Maybe she's smoked her whole life. Maybe she drinks moderately, doesn't exercise, you know, and she comes to me and she says, like, I have this back pain. And I say, okay, so what are you going to do about it? Well, you see, the problem is that if I had met you 20 years ago, I would have explained that life is a process, right? And it's not life is not trying to get better. If anything, from an evolutionary standpoint, what your body is trying to do is conserve energy. It's trying to get the things it needs, but at the underlying all of this, it's energy conservation. So adaptation is not what your body's trying to do. So in order to make your body adapt, you have to force it to adapt. You just have to put in that work. So if you give me that client who's 50 years old and, you know, smoker hasn't really cared for her health, I'm not saying I can't help. I'm not saying that it's the end of course there's things that can be done. Of course we can help people with pain, but you have to be very conscious of as time goes on, it's not what you do today or yesterday, it's what you have done. It's like I ask clients, like, "Do you supplement? Do you take supplements?" "Yes, I take, vitamin D." "Well, how often do you take vitamin D?" "Well, it's a daily dose." "No, no. How often do you take your vitamin D?" And then it becomes, "Well, in the morning I try to remember, so probably 3, 4 times a week." And I go 4 times every week? "Well, no, there's chunks of time where I don't take vitamin D." And then at the end of it, I'm like, "Okay, so you don't supplement with vitamin D." So that's the point. Just because the vitamin D is there, just because you bought workout gloves, it doesn't mean that you're gonna get better, right? It does take work, and I don't think it takes any more work to do what I'm saying, but I do think it takes coming to, at this moment where you think to yourself, "Oh my god, I'm trapped in this world of exercise and nutrition, which is giving generic advice, but I'm not just a generic person. I have, you know, a history. I have genetics that are involved here. I have a different lifestyle. I all of these things. I don't like my job. I don't like all of these things have to be factored in if you want to tailor exercise to you. And then I'll tell people, if you just like the generic things that you get from training, by all means continue. But there's a large number of people who obviously nowadays with, podcasts like yours, obviously people want more. There's some people want to take onus of their own health and they want to do it for themselves. And for those people, there is a little bit of learning that need be done, like we said before. But it's not a thing that's difficult to overcome. It could be a matter of looking at the things you're doing, erasing a few of them, putting in different things just to be more specific, and then carrying on. But it also has to do with really understanding who you are as a person. Am I an Olympic lifter? Am I a hockey player? Is that really do I want my body to become a hockey player's body, or do I just enjoy using my body to play hockey? There's a huge difference. If you want a bad hip, I'll give you a good method to get there. Become a serious hockey player. I've assessed almost I don't know how many hips in the NHL, and I think I've only found 1 or 2 that I was relatively happy with from the get-go. I mean, the fact that you're doing something that's not part of the natural evolution of our species, playing hockey is a abnormal stress, right? For millions of years, we've adapted and selected for it in a way that when I put a posterior force into the ground, I project myself forward. That's how I run. That's how I walk. Now you're going to play hockey. So now I say, forget all of that. I'm going to put a blade at the bottom of your foot. And now I'm going to tell you to propel yourself forward. I need you to push out to the side. And I need you to do it thousands of times since you're able to walk. And then when you have a 30-year-old NHL player saying, "My hips are so stiff, I can't play anymore." And they go, I don't understand why. It's like, don't you understand why? Like, there's a reason why hip injuries, groin injuries are so prevalent in hockey. The answer is hockey. That's right. So even these athletes, as I said, I've worked with large number of professional athletes, and I have to explain to them, human first, athlete second. Human first, athlete second. If I improve capacities and capabilities of your body, that will lead to better hockey. But if I just focus on better hockey, it doesn't go the other way. Better hockey does not lead to better David's hip. It does not. And as a matter of fact, it makes it worse. So if we're talking about high level athletics, one of the major hurdles that I have to, when I go into these organizations, one of the hurdles is explaining this to them, explaining that I understand that you want performance, but do you want performance out of this client, out of this hockey player for the next 5 years of their contract, or are you just looking for the next 6 months? Because that hip has 6 months to go, right? So you really do have to change your focus in training.
Human first, athlete second.
Human first, there you go. That was the thing to pull there. Human first, athlete second. Yeah. Yeah.
Very well said. Dre, this is wonderful. We're going to leave links to your site and to the resources there.
Yes.
And I've been exposed to some of the FRC training and Kinstretch and such.
Oh, wonderful. That's wonderful.
And you've just reminded me, because of sort of what I've been through the last couple of years with my leg, this needs to be attended to before we start getting back to squats and deadlifts and stuff.
100%. And you got to get there, right? Squatting's great. Deadlift, all of these things are great. There's just, you also have to factor in what do you want to do as a human? How do you want to enjoy your life? This is also important. However, just like sports, enjoyment has prerequisites, right? You have to mold your desires to the capacities that you have, or you have to work like hell to increase those capacities, and both of which are attainable. And we do it with thousands of people across the globe all the time. So it's not a unreachable goal. It really, really isn't. Learn a CARS routine. Start moving your joints specifically, mindfully, purposefully, more often than you usually do. Understand that you did not evolve to become an office worker, that whatever you're doing right now, your brain's getting better at it. So if you've been sitting for the last 8 hours, this is not normal human function. So take some breaks, get up, don't just wiggle around. move each individual joint through the ranges of motion that it has. It's going to maintain the ranges it has. It's going to bring health to your joint. It's going to teach you about yourself. And then you just have to kind of learn the skills you need, that once you have information about yourself, how do I counter this information? How do I apply exercise specifically? And then you just start doing it. I always tell a good example, people, if I erase an exercise for the triceps, they go, "Oh my God, I'm gonna lose my triceps." And then I say, "Well, when was the last time you put in a 6 to 8 week training block to increase the hypertrophy of your rotator cuff muscle?" And they go, "Well, the answer is the last time they got injured, right? Because when you get injured, all of a sudden you start doing these rotational. But as soon as you feel better, bench press, lateral raise, overhead press, snatches, all of this stuff. And then the person goes, "Well, I haven't done that. I never put a 6 to 8 week wave of hypertrophy training into my rotator cuff." It's like, well, why were you so worried about your tricep a second ago? If you don't train your tricep for a week, you panic and you go, "I'm going to get smaller triceps." But you've never trained your rotator cuff, but you just assume that it's going to be there in the end. But it's not. It's not there because it wants to be there. If it's not getting physical stimulus, it breaks down. It doesn't matter what you think it's going to break down. If you don't brush your teeth, it breaks down. It's the same thing. You need joint hygiene, just like the rest of your body needs hygiene. It's the same concept.
Wonderful. Enjoyment has prerequisites. Absolutely.
I feel like you only asked like 3 questions, and I just bogarted the entire conversation, so I apologize, but yeah.
Maybe it was the right 3 questions.
Yeah, I guess so. Yeah, I'm used to talking this. I can literally go on for 3 hours maybe without you even speaking, and I'd probably be okay to rant on. I hope somewhere in there you got some interesting, useful tidbits.
Absolutely. Absolutely. Very much so. Dre, it's been a pleasure.
Pleasure talking to
Um,
you too, Dave.
I'm a huge fan of your work. It's been hugely influential with, a lot of people I know. It may be more in the mainstream than you think, and that's
Yeah,
that's a good thing.
I appreciate that. My wife always gets mad at me because I say when I go to seminars, people come up and they say, "Thank you for doing this and develop," and it makes me really uncomfortable. So she goes, "Just say thank you." So thank
Yeah, that's right.
yeah, yeah. So
Your wife is right.
as always.
Dre, thanks so much. We're going to leave all your contact information in the notes.
Okay.
I personally, when we get off this call, I'm going to find myself a practitioner here.
Oh, that's great. That's great. I'd like to get some good eyes on that knee so we can, specifically target, because the same thing I was saying for rehabilitation is no different. It's got to be specific to your knee. It really does, to the injury, to the surgery. Everything has to be dialed in if you want the best outcome.
I'm thinking in my personal case, it goes from the toes to the feet, to the ankle to the knee, the hip, the low back.
Yeah.
My feeling is the whole thing is just, I need to
Nice.
pay a little attention to that right now.
Pay some attention, give it a few blocks of time, and you'd be amazed at how many problems you find and how many solutions you find. It really is remarkable.
Very good. Appreciate your time today, Dre.
Thank you very much, sir.
Take care.
Bye-bye.
Bye now.
That wraps up our conversation with Dr. Andrea Spina. His insights into mobility and joint health underscore the importance of proactive care of our pursuit of a vibrant, active life. He said a couple of things in there that I thought were really just profound. This idea that good life is work. It doesn't just happen. You just don't happen to have a good life. You have to work at it. And some of this stuff that he's talking about, as I mentioned in the podcast, it's really hard. Like getting your brain to tell your hip to move in a way that it hasn't for a very long time, or any other joints. There's a difficulty there. And I like what he was talking about at the end there about, are you training for a human? Are you training as an athlete? And his comments there about hockey players and how a lot of the sport movements we do are not really the best for our bodies. Example A, ski racing, and my currently recovering partial knee replacement, which I'm sure ski racing did not help that, but it's still something I like to do. I also think what was important was this idea of personalized movement. This is something I think is so important, and it gets just passed over so easily. We now know that foods affect us differently. We have different blood work. We have different genomes. Everything's different. We're all individuals, right? N of one. But when you go in to see a trainer, and I've seen a lot of them in my life, very, very few of them are going to personalize what they do with you. And especially if you've got an app or something that says like, do this many reps of this thing and you're going to get better. Well, yeah, maybe not. And I think that one of the sort of next frontiers out there, it's not even a frontier. I mean, Dre is one of the people who pioneered this. He's like the pioneer in this. This idea that our physicality needs to be personalized, that what may work for me may not work for someone else. And to treat everybody the same, you should do X exercise, this many reps, whatever, and you're going to get better. Well, yes and no. It really depends on your underlying movement patterns, your ability to move around, and that needs to be customized. I have seen, I don't know, maybe 1 or 2 people in my entire life who really understand this. And I think that it's one of the things, as I asked Dre, I said, how do I find one of your people? So immediately after I recorded this podcast, I went onto his site and I looked up all the practitioners in my area because I realized I've probably got all kinds of like strange movement stuff that's built up in my body after 66 years, but also I've got this like goofy knee, which I have been compensating for 3 years. And now I've had surgery on it. So now there's even more unbalanced movement stuff that I've got that I need to take care of. Let's get that figured out before we start loading stuff up, which I find really annoying and irritating, truthfully. I'd much rather just like go down to the gym and pick up like stupid heavy stuff because it's fun. And doing the sort of work that Dre talks about, it's really hard. For me anyway, it's not a lot of fun. It's like, you put me in a class for Mandarin. Okay, it's not a lot of fun. It's hard. It's really hard brain work. It's training our brain to reconnect with part of our body that may have gone to sleep, and that's hard. So those are my thoughts on FRC. I think that he has made just a really tremendous contribution to the world of sports, the world of mobility, and just understanding what is mobility. So if you're interested in learning more about functional range conditioning or exploring Dre's work, go to functionalanatomyseminars.com. You'll find resources, seminars, training programs designed to help people, basically trainers, move better. And in there was a list of people who have taken these classes, and you can see their level of certification. Those are the people that I'm going to be looking for later this week. Coming up in this week's newsletter, we have Fran Meyer, 78-year-old pickleball champion. She's redefining what's possible at any age. She's funky. We like her. This week's recipe, oat and date snack bars. So I love these. Perfect for sustaining energy. Health science breakthroughs. We learn how carbohydrates can support better aging. We're exploring new painkiller that offers relief without the risk associated with opioids, and understanding why nanoplastics may increase the virulence of foodborne pathogens. Super interesting. Don't miss out on these insights. Please subscribe to the Aegis newsletter today. So quick update here, the knee. So I'm now 4 weeks out of surgery. My left foot now pretty much looks like my right foot. A couple of weeks ago, it looked like this weird multicolored balloon attached to the bottom of my leg, and it hurt. Now that's sort of gone away. It looks like a foot. My lower leg sort of looks like a lower leg. My left knee is still probably 50% bigger than my right knee. And this is like 4 weeks out. I thought, oh man, we'll be done with this. But the steri strips came off yesterday. So I have this nice sort of scar that's forming on the front of my leg, which is good. We want to close that wound. And tonight, because it's 4 weeks out, I am allowed to go to sauna again. So I'm excited about that. And tomorrow I'm going to start my pool work. All I can say is this stuff is just tedious. Like, I don't know what I was thinking. I was certainly thinking that my knee would be in much better condition now than it is. Partially it's because I'm 66, okay? But partially to get a little graphic here, what they do is they slice open the front of my knee. There's an incision. It's a good 12 to 14 inches long. They open up the whole knee capsule. They pull away the meniscus so they can get to the joint in the back, and they pound in this metal piece to my femur and a plastic receiver onto my tibia. They fold back the meniscus, they stitch all that up, and then they close the whole thing, the outer skin up, and they stitch all that up. Invasive. So people are asking me, is this like a good thing? Is this going to be better? And I say, well, talk to me in 6 months and I'll let you know. So I will be doing an episode coming up in the next couple of weeks about all the different recovery stuff that I've tried, what works, what doesn't. And everybody's different on this. I will say
David's type A fail on this was I had all these protocols dialed in for total knee replacement. I downloaded Kelly Starrett, the Supple Leopard guy, another big mobility guy. He has a whole protocol for total knee replacement. I thought, this is great. I got all this dialed in. This is what I do on day 1, day 2, day 3. I did not have total knee replacement. No, I had something entirely different. When you do total knee replacement, there's no more meniscus. They just throw that out. It's a very different thing. It's a different kind of healing than what's happening with my knee. And so that was a fail. And I've sort of gone back to what my surgeon has recommended that I do. And I'm following my PTs really strictly, trying to do my best to get this thing to heal as well as I can. So no shade on Kelly. He's great. He's amazing. His protocol was not for what I had. Duh. All right, let's move on to Just Try This. So this week, we're going to be talking about minimizing food waste. And before your next grocery run, maybe take a moment to assess your weekly schedule. What's coming up? What are you actually going to eat? Determine how many meals you're going to be eating out versus what you can eat at home, what you want to eat at home, and try and plan your meals accordingly and create, guess what, a shopping list, which is sort of something that I don't do too often. I tend to just go to the supermarket and throw stuff in the cart that looks good, but that's not really the best way to do this. So you want to include the ingredients that you're actually going to cook. And once you're home, you want to organize your refrigerator and use this sort of first in, first out method. So you place the older items in the front, so they're the first ones to use. So then your food doesn't spoil. And you want to get creative with these leftovers. I love leftovers. Take last night's roasted vegetables. I become the omelet filling for today. I think I learned all of my cooking skills in the Boy Scouts, or at least that's what my wife tells me. I'm still alive, so it's all right. If you're keen on eating the same meal consecutively, you can freeze the leftovers, and then you have an option for a day when you're busy. And remember, your freezer is this powerful tool to extend the shelf life of both raw and cooked foods. I love freezing things. I buy frozen vegetables, I buy frozen fruit, just because they don't go bad, and then it's like always there. So by adopting these practices, you're not only going to reduce your food waste, you're going to save some money, and you're going to have a more sustainable lifestyle. That's our tip of the week. Until next time, stay curious, stay active, continue embracing the journey of aging with strength. Take care now.